My name is Louis Castellanos. I'm an OB hospitalist in Texas. I work at one of the large referral hospitals, and we have an accreta team, which consists of the OB hospitalist, maternal fetal medicine, gynecologic oncology, and anesthesiology. We had a patient on our service that was admitted at approximately 15 to 16 weeks with a diagnosed placenta accreta from a hemorrhage. She stayed in-house until planned delivery. We had planned a cesarean hysterectomy. When she was 23 weeks and 1 day, I was on service and was called to the antepartum unit when she started hemorrhaging around 9 p.m. I went immediately to her bedside to assess and noticed that she was sitting in a pool of blood and she was having significant abdominal pain. So I called for an immediate C-section. She was taken to the operating room immediately, and once anesthesia was administered and she was prepped and draped, proceeded with the procedure through a vertical incision. Upon entering the peritoneal cavity, the placenta was noted to have perforated through the lower uterine segment and was attached to the bladder as well. I was able to rapidly deliver the fetus, which was handed to the NICU team for resuscitation. To control the bleeding, I rapidly closed the hysterectomy incision, and shortly after this, the gynecologic oncologist arrived. He was able to help us dissect the bladder from the lower uterine segment and proceed with hysterectomy. During the procedure, she required approximately 10 units of packed red blood cells as well as other blood products. Also during the procedure, a 3 to 4 centimeter defect was noted in the dome of the bladder from the dissection, and a urologist was called in to repair the defect. Following the procedure, the patient was taken to the ICU per protocol, but because we were able to stay ahead of her blood loss, she was able to be dismissed from the ICU the following morning and had a fairly rapid recovery and was able to be discharged from the hospital approximately 2 to 3 days after her surgery. The following week, she came back for staple removal and expressed her gratitude to me. Both her husband and the patient were very happy with the outcome. The following week, she also returned for a scheduled cystogram and voiding trial so that we could remove her Foley catheter following the bladder repair. When she arrived that morning for her scheduled cystogram, unfortunately, the radiology department had dropped her appointment time. So I spent most of that morning on the phone with different administrators and supervisors in the radiology department, the interventional radiologist, trying to get her rescheduled, but they kept insisting that they didn't have an opening. Fortunately, they had a no-show that morning, so they were able to work her in. When she was taken down to the radiology department around 10:30, we waited for the result. But approximately 90 minutes later, we were called and told that she had never arrived at the radiology department. It turned out that the patient clerk had taken her to the wrong radiology department. She had gone to the outpatient rather than inpatient. So I went and picked up the patient and took her to the inpatient radiology department. And upon arriving there, the department was mostly empty because they had all just left for lunch. However, the radiology tech that was there told me that if we would have her back at 1 p.m., that they would be able to perform the cystogram at that time. So she went to visit the baby in the NICU for the next hour, and I went back to pick her up from the NICU and take her back to radiology. She had her cystogram, and at approximately 1:25 p.m., we were called and told that she had completed the cystogram and passed, and they asked that somebody come pick her up. So this time, rather than asking the clerk to go, I went myself to pick her up and found her sitting in the hall by herself. The radiology department was again empty. I'd asked her where everybody was, and she said that they had all gone outside to view the eclipse, which was going to occur in the next several minutes. Her husband had also gone outside. I happened to have an extra pair of eclipse glasses on me, so I offered to take her outside, and we went out and viewed the eclipse together. I had to push her through a crowd of other employees out to the foyer, and we were able to view the eclipse together. Following this, we went back up to the OBED where she had her Foley catheter removed. She was able to pass a voiding trial and was able to go home. Again, both she and her husband were very happy with the care that they received. I definitely feel that having a hospitalist present and the entire team, the accreta team that was ready to manage her, saved not only her life, but the baby's life. The baby's now about 5 to 6 weeks of age post-delivery and is doing well in the neonatal intensive care unit.